Good afternoon, everybody. I wanted to start this afternoon by showing you a national graph that shows the 7-day average number of cases reported per day here in the United States. And I wanted to show you this because I wanted people to be aware of what happens to the data around, holiday weeks. So you can see in this national graph that cases were increasing rapidly, but then there was a decrease in case counts around the holiday week. And that's generally because a lot of people aren't interested in getting tested if they're mildly ill over a vacation or over a long holiday weekend. And sometimes testing is just not as available on long holiday weekends as well. But what you can see in the national graph is that, despite this little dip, in the following week, the case counts picked right back up again and kind of followed the same original curve that was occurring prior to Thanksgiving. So I wanted to show you that before sharing our graph of case counts, which you all are familiar with at this time. This shows our number of confirmed cases over time. And just wanted to point out that, our COVID-19 case counts do remain extremely high, as John just mentioned. As you can see, we are quite a bit higher than the case counts we had back in the spring and in the summer. Similar to the United States, the US graph, we also are seeing a little dip in our cases around the Thanksgiving week. If you look on the dashboard and look at the actual days of this, this is right when the week of Thanksgiving. But we're not really quite sure what's going to happen at the far right-hand side of the graph. How much higher this particular curve is going to get, whether it's going to get way up here and continue the current graph, or whether it will end up a little bit lower. So we were very closely watching our data to see what happens to this graph in terms of trends post-Thanksgiving, but the bottom line is that our case counts do remain very high. Since we have not shown you test positivity data on our dashboard due to a backlog in getting some of our negative lab results into the dashboard, I did want to show you some data that we received from the federal government. So about 70% of the COVID tests that are performed in Washington get captured in the federal reporting system. Hospitals and commercial labs that are testing people in the state report directly to the federal government, and we can download the data. The blue line represents the daily total tests. It's a 7-day average, and you can see there was a big uptick in testing right before Thanksgiving. And we remember that because a lot of people wanted to go out and get tested, and a number of our test sites were, experiencing really high volumes. Since Thanksgiving, there has been a drop in testing, but it seems fairly close to sort of the trajectory that we were on before the Thanksgiving weekend. And additionally, the week after Thanksgiving, we did see an increase in the positivity of all the tests being performed, which I would call sort of a concerning signal in the data at this point. But we need some more time to sort of understand the trend for percent positivity. The next graph shows patients hospitalized with confirmed COVID infection per hospital admission rate. Leading right up to Thanksgiving, we had a very steep increase in the number of patients being admitted to our hospitals every day. And again, it's a little bit hard to tell now what's going to happen in this region of the graph, since the data in this part of the graph is not yet complete. We're waiting for it to fill in. So I would say that post-Thanksgiving, it's a little bit difficult to know what our trends are going to be, what our trends look like in both cases and hospitalizations at this time. Unfortunately, our COVID-19 deaths are steadily increasing. We know that this graph lags behind our case and our hospitalization graphs and really does not seem to be slowing down at this point, unfortunately. And then the last few graphs I want to show come off of our risk assessment dashboard. They show COVID-19 hospital bed occupancy. And this graph represents bed occupancy for the entire state. And you can see when we were experiencing a very rapid growth in the outbreak in Washington around the end of October and early November, we had a very sharp increase in the number of COVID patients in our hospitals. And you can tell over like the last week or so, this increase has decreased. So hospital bed occupancy remains high and appears to continue to be increasing, but the rate of increase seems to have slowed down. And I think that this is a positive signal in our data. This is the same graph that I just showed you, but it's broken down by different regions within our state. And I just wanted to make the point that COVID-19 hospital bed occupancy is very high, like throughout the whole state. So in the summer, when we were just seeing a lot of activity in Central Washington, it was a little less concerning because we knew we could move patients from Central Washington out to Spokane or over to the Puget Sound area if they ran out of hospital beds. But what's really concerning this time around is that we don't have that. We may not have that ability to do that because hospitals in all of our regions have very high bed occupancy, and many of them have much higher bed occupancy than they've had, since the pandemic started. You can see that most of these areas continue to see increases. I did want to point out South Central Washington. They were a little slower to show increases in bed occupancy this fall, but you can see that they're almost to the number of patients that they had this summer. And this summer, when they had this many patients in their hospital, we did need to transfer some patients out of the Yakima area over to the Seattle area because their hospital couldn't really keep up. And now it looks like the number of COVID patients is getting really pretty close to where they were this summer, which is concerning. And then lastly, I just wanted to show you that COVID-19 ICU bed occupancy also continues to increase. There are now almost 300 confirmed or suspected COVID-19 patients in our ICUs throughout the state. And this is concerning because, when we talk to the hospitals, they are most concerned about their ICU capacity because, particularly because of concerns about shortages in staffing ICUs. So in summary, COVID-19 activity does remain extremely high here in Washington. And unfortunately, we don't have quite enough data yet post-Thanksgiving to really feel confident about the current trajectory that we are on post-Thanksgiving. So that current trajectory is just not 100% clear yet. Hospital bed occupancy is very high, as I just showed you, and is rising, but at a slower rate. So we think that that's a positive signal in the data. As John mentioned, hospitals are continuing to cancel many non-urgent procedures because they need to cancel these procedures so that they have staff that can take care of COVID patients rather than post-operative patients. And so I know we are all really tired at this point in the pandemic. I am as well. But, everything we can do to continue to limit the amount of social interactions in our lives, the better, to help bend this curve. As a reminder, please mask up and keep your distance from others when you're out and about. Stay home as much as you can and really avoid gathering indoors with people who are outside of your household.